Good day, everyone. I'm Dr. Elemile. I'm a family physician, and today I'll be talking about preconception care. One of my area of special interest is maternal and child health, and that's why I'm talking about preconception care today. One way to reducing morbidity and mortality in women and children is preconception care, and we're going to achieve that as part of the sustainable development goal. So we have to start to look at preconception care. So what is preconception care and why is it important? Preconception care is the care given to women and their spouses or partners in prior to pregnancy, prior to being pregnant. It helps you to identify risk factors that can impact negatively on pregnancy and the unborn child, or even after giving birth to a child. Helps you to identify such risk factors and helps us to address those factors even before pregnancy is achieved. It helps a woman to be able to determine this is when she's ready to get pregnant. Helps her to also look at the options that she has in order to space a pregnancy. So you can, for women who have not gotten pregnant before, they can have preconception care. Even women who have had children can also have preconception care, which in that case would be an inter-pregnancy care. So what do we do in preconception care? The first thing that is done is risk identification. So the person offering you preconception care will want to identify risk factors. So the person is going to ask you certain questions. Okay, have you been pregnant before? What conditions or diseases do you have that can impact on these pregnancies? On this pregnancy, what drugs are you on that can impact on this pregnancy? So based on those questions that we call history taking, the person will identify certain risk. The person will also do a thorough physical examination on you, examine you for head to toe to determine some other factors, and the person will send you for some tests that will also further help the physician to identify risk factors that can impact pregnancy negatively. Based on these risk factors identified, your physician can now counsel you appropriately. So counseling is another major aspect of preconception care. The other things that are done during preconception care is to offer you what we call ChemoProphylaxis. Immunoprophylaxis. ChemoProphylaxis are drugs that you give to women in reproductive age group prior to pregnancy, and one of them is folic acid. Folic acid is very essential to prevent neural tube defects, congenital anomalies, or miscarriages in women of reproductive age when they are ready to get pregnant. Aside that, based on drugs, I said that the doctor will ask you what conditions or drugs you're on. So there are some drugs that are not safe during pregnancy that the doctor might ask you to stop or provide safer alternatives. There are some medical conditions that women have, for example, hypertension, diabetes, and the likes, and that they are taking medications for that would need to be addressed in the preconception care. Blood pressure needs to be optimum, blood sugar, blood glucose will need to be optimum before conception, and those things are very important prior to pregnancies. For example, a woman may have epilepsy and she's taking certain medication to control seizures. Such medications may not be safe for and safe during pregnancy, and would need a safer alternative may be needed to be provided prior to pregnancy. For such women, we may also want to give them higher doses of folic acid in order to prevent congenital anomalies in their babies. Without preconception care, that will not be done, and the one could get pregnant and the child will be deformed. So preconception answers all those questions, addresses all those things. Aside that, things that have been identified in the risk assessment, some of them may require treatment that will be done during preconception care. Finally, preconception care may also require referral services, referral to to other physicians for what we call referral services. You may need to see a gynecologist, you may need to see other specialists, you may need to see an internal physician. One may need even to see a mental health provider even prior to pregnancy, and that will be done in the preconception care. Of course, follow-up services, you've seen a woman, you want to see that woman and the spouse, you may need to see them again and again. So we provide follow-up services also during the preconception care. So who can provide the preconception care? People who practice primary care. Primary care physicians generally can provide preconception care. Specialists like gynecologists also can provide preconception care. So in order to reduce morbidity in women, mortality in children, peripartum mortality, perinatal mortality, neonatal mortality, under 5 mortality, we need to start looking at preconception care. It's very important that we start to incorporate that in our practice, and people are aware that they can walk in prior to pregnancy to meet their doctors to say, please assess me. Am I ready for pregnancy? What are those things that could hinder me getting pregnant, or things that could affect my baby even before they decide to get pregnant? What options are there for me to space my children? Oh, I'm not ready to get pregnant yet. How do I space when I'm okay? And then after you've been given something, you've been offered contraceptive services. Oh, I'm ready to get pregnant now. How do I achieve it? That's what preconception care is for. Thank you very much for listening to me. Please remember to click and subscribe to this channel for more medical information. God bless you. Have a good day. Bye. I remain Dr. Ilimile.